Welcome back everyone, my name is Dr. Waves, I will be representing Dr. Yvonne, and today we will look at sickle cell disease. If you haven't watched our previous health videos, please do well to watch them. Take your health seriously, so that a disease won't take you seriously. So we will begin. What is a sickle cell disease? A sickle cell disease is a group of inherited red blood cell disorder. Healthy red blood cells are round in shape, and they move through blood vessels, carrying oxygen to all parts of the body. In sickle cell disease, the red blood cells are sticky, and C-shaped like a farm tool, called a sickle. These sickle red cells can get stuck in small blood vessels, and block the flow of blood and oxygen to organs in the body. These blockages cause repeated episodes of severe pain, organ damage, serious infections, and even stroke. Take note that the normal red blood cells usually have a lifespan of 120 days, but a sickled red blood cell has a very short lifespan of about 20 days, and this causes a constant shortage of red blood cells, thereby depriving your organs of oxygen and nutrients. Very critical. You can carry on, Dr. Emmanuel.
Thank you, Dr. Waves. So sickle cell is inherited, and this occurs as a result of a mutation. I won't go into the details of the pathophysiology, but one should know a sickle cell disease is hereditary and caused by a genetic mutation. There are various subtypes, but what is common in all is the hemoglobin S. One could have a sickle cell anemia, which is denoted as SS, or a sickle cell trait, which is denoted as S. We will upload an illustration to denote how children of both an SS and a S genotype can inherit this sickle cell disease from their parents. So, one will have a sickle cell trait if one of both parents is an SS, and the other hasn't got any S genotype. Or a sickle cell anemia if both parents have one or two S genotype. That is an AS married to an SS, or an SS married to an SS. Curing sickle cell is almost impossible, although new scientific researches are seeking ways to get a permanent cure. We hope for the best. The signs and symptoms of sickle cell disease include 1. Pain. This pain is so severe, it could be a chest pain, back pain, joint pain, headaches. 2. Blurry vision. 3. Recurrent infections. 4. Leg ulcers. 5. Weakness. 6. Fainting or loss of consciousness. 7. Yellowing of the eyes, called jaundice, pale eyes and palms. In babies, usually after 6 months, they tend to have swollen hands and feet, what we call dactylitis. How best can we live with a sickle cell disease? Dr. Waves, please carry on.
Thank you, Dr. Emmanuel. There is no single best treatment nor cure for sickle cell disease. Treatment options are also different for each person, depending on the symptoms. We can prevent this by 1. Genetic screening, that is to say, 2 persons with an S genotype should not get married, as the chances of having a child with a sickle cell disease is high, and this child ends up suffering. Quite unfair. 2. Adequate intake of water. In those who already have a sickle cell, this helps your blood become less sticky. 3. See a hematologist, that is a specialist doctor who deals with blood-related diseases, for adequate assessment. If you already have a sickle cell, these doctors will also prescribe certain medications, which will improve your quality of life. Please note, sickle cell is not caused by spirits. Do not stigmatize individuals with sickle cell. It is not their fault they have the condition. If you are privileged to be sickle cell free, be grateful and encourage anyone you know who has sickle cell disease.
The World Sickle Cell Day is every 19th day of June. Spread the awareness. Have a beautiful morning. Goodbye.